My name is Dr. Alex Amar. I am President and CEO of Wichita Surgical Specialists. Have been in the group for 41 years. It was founded by my uncle George Farha in 1963, and a year or two later he was joined by his brother Jim Farha. I believe Wichita Surgical has been in Wichita for 60 years, mainly because of very deep relationships that have been massaged over decades, not just in the healthcare community, but also in the community at large. My favorite memory is probably when my uncles retired in 1997, the end of the year. I gave one of the recognition talks during that time, and Dr. George was nicknamed Sweetheart George, and Dr. Jim was Tiger Jim. Dr. George would give you a blank check, and Dr. Jim would demand a 50% discount.
My name is Carrie Clark, and I am the administrator for Wichita Surgical Specialists. My position as administrator of Wichita Surgical Specialists, I kind of look at it as, since we're celebrating our 60th year anniversary, I'm the administrator in the last 30 years, but the first 30 years, Joanne Gerber, she actually was the administrator for 27 years and hired me as Director of Communications and then moved me into the position of administrator. And Dr. Amar actually became the CEO the same time I became administrator. So the first 30 years it was Joanne and the Dr. Farhas, and then the second 30 years it's Dr. Amar and I in those positions. I think it's very unique that Wichita Surgical Specialists has had 2 CEOs and 2 administrators as well, but we've had the same foundation and philosophy all along.
My name is Diana Rum, and I have been with Wichita Surgical Specialists for 37 years. One of the things that I will cherish forever is having been able to work with the doctors that started this group, and Dr. George Farha, Dr. Jim Farha, Dr. David Street. George, he'd walk into a room and he'd clear his throat and everyone would just pay attention to him, and Dr. Jim would sponge off cigarettes from employees. We could smoke back then in the office, and Dr. David Street had a wonderful bedside manner. He was just like an angel.
When Dr. George and Dr. Jim Farha were here, they ran a very tight ship. And at that time, all of our clinical nurses, medical assistants, they all had to wear white. So when the Farhas retired, let's say on a Friday, Monday morning we changed the dress code and all the clinical could wear colorful scrubs at that time.
My name is Dr. Chad Amar, and I'm a vascular surgeon with Wichita Surgical Specialists. I've been with this group for 8 years. I have some very fond memories growing up, being exposed to my great uncles, and then my father. Do have memories of coming to the office and getting candy. There was always a room with a big bowl of candy that my dad's nurse Renee would always allow my brother and I to get into. I also remember long discussions that my dad and his uncles would have about the group and some of their visions that they had that I think have definitely sort of stuck with me, and I think that to this day a lot of those visions have come to fruition.
My name is Samantha Beck. I am a general and breast surgeon here at Wichita Surgical, and I've been with Wichita Surgical for 9 years now. I think something that sets Wichita Surgical apart from other surgical groups is we're really a community in ourselves. We have surgeons across a lot of specialties really, so we can offer a lot to our patients. We're also involved in education with the residency and medical schools here, and I think that it's really important to pass it on, pass the knowledge on, and I think for a group of surgeons our size, it's pretty remarkable that we're all involved in education in that way.
Throughout our history at Wichita Surgical Specialists, we have also had a lot of firsts in the community, such as the medical director of the Burn Center and helping establish the center, the trauma center and having the first surgical intensivist, the first renal transplant in Wichita, the first heart transplant in Wichita. We also did the first laparoscopic gallbladder in Wichita. We've done several robotic cases as well.
I'm Dr. Brent Lancaster. I'm a general surgeon at Wichita Surgical Specialists. I do bariatrics, trauma, endocrine, and a lot of laparoscopic stuff. Probably one of my best memories was doing the first bariatric surgery in Wichita. Bariatrics had been done years before, what we call the old-fashioned way, or open. We brought in laparoscopic bariatric surgery, which is a game changer for those patients.
Dr. Jim Farha was one of the first to do a bypass surgery. We did the first transplant, heart transplants here. I remember I had only been working with the group for like 4 months when they had the first heart transplant here, and I remember we had TV cameras in our lobby, and I'm thinking, where am I working? What is this place? Because it was, pretty amazing.
I'm Dr. Mark Niedery. I'm a general surgeon with Wichita Surgical Specialists. Kind of a unique attachment I have to the group is my father trained at St. Francis. He was in the first general surgery residency class that ever was approved, and he was actually George Farha's chief. One of the greatest parts of the group is each year we have a Christmas party. All staff are included, and we've traditionally had several satellites, so some doctors don't see each other that much and some staff don't work together that much, but we all come together and it's a chance to meet spouses we've heard about. Likewise for the staff to meet our spouses. I think that kind of seals it, and at the holidays it makes it really special.
Hi, I'm Dr. Aaron Niles, general surgeon. I've been with Wichita Surgical Specialists for 6 years. Something that's very special with Wichita Surgical Specialists that I didn't realize getting into it was the relationships you develop with your staff. One of my favorite memories at Wichita Surgical Specialists is when there was a pie drive that all the staff at Wichita Surgical Specialists chipped in and donated goods, voted on who they'd like to get a pie in the face, and unfortunately myself and Dr. Lancaster got the most votes, and so we both got pies. It was a very fun event that really brought everybody together. My hopes for Wichita Surgical Specialists in the future is a continued growth in relationships and strengthening relationships with primary care docs as well as subspecialty physicians throughout the community. In addition to continue with the growth of relationships with the hospital system to provide the best care for patients possible in the community of Wichita as well as the surrounding area.
I hope as a group that we just keep pushing ourselves to bring new and innovative medical ideas and systems here to Wichita. I think the community can only benefit from the things that we can bring.
Another thing that I'd like to see happen with Wichita Surgical is that we continue to grow, that we don't become stagnant, that we change as the environment changes and recruit the type of people that we need to meet the needs of not only this community but the surrounding state as well.
I think if I had one wish for this group, it would be that we could stay together another 60 years.
Thank you, Wichita.
For allowing us to make this a stronger medical community.
Thank you, Wichita.
For allowing us to serve you for 60 years.
Thank you, Wichita.
We are honored to have served this community's surgical needs for the last 60 years.
We look forward to the years to come.
We are very grateful to have been part of the Wichita community all these years. We've taken care of many, many patients, and we do it in the best way we know how. We are committed to continuing that effort for many years to come.